So in today's session, we'll be discussing about some standard procedures used for different equipment. How do you sterilize them? How do you clean them? Or how do you disinfect and infect them? What solution has to be used for what type of item? Okay, that we will discuss here. These are the certain tables that you will find in your textbook. It's the same tables. Okay. We can mention the page number in the chat box. Standard procedure for cleaning and disinfection of reusable PPE. Personal protective equipments which you can reuse, which can be used again. Okay. For those instruments, how do you reuse it? Okay. What should you do to reuse it? For example, N95 mask. It's not reusable. It's disposable. Once you use it, you have to throw it away. Okay. N95 mask should not be reused. Okay, so you have to discard it in appropriate waste container, waste bag. Okay, and they will have a written information nearby where to discard it. So it has to be discarded in that particular bin. Okay, so you don't have to follow any standard procedure here. HEPA mask, P100 mask, HEPA mask. Only the filters are disposable. The entire mask you don't have to dispose. Okay, you can remove the filters and then discard the filter. Okay, but the entire body of the mask, you can just take spirit, 70% alcohol, and you can just disinfect it, or use detergent and water, clean it thoroughly, rinse it thoroughly, clean it in cold water and dry it. Okay, and then put a new filter in and then use it again. So only filters you have to discard. The mask can be reused using spirit. Okay, eye protectors, goggles, face shields. They come in two types. Some types of face shields are single use, some type of face shields are reusable. Okay, so single use one has to be disposed. After every single use, it has to be disposed in appropriate waste bag. Okay, but again, if it is reusable, the same procedure. Either use spirit, detergent water, okay, or you can soak it in hypochlorite solution as well for 20 minutes and then rinse it. Okay, 1% hypochlorite solution you can use. 20 for 20 minutes, keep it immersed in the hypochlorite solution, and after that rinse it with clean water, dry it. Okay, so that you can do. Gowns also come in two formats. Okay, disposable ones and reusable ones. Disposable, again, it's written in which waste bag you have to throw the used gowns. If it is the reusable one, the cloth one, okay, laundry has to be done for it. It has to be sent for laundry. Okay, and the water temperature should be between 70 degrees Celsius to 80 degrees Celsius if possible. That the laundry department has to take care of it. Okay, otherwise, if temperature control is not possible, certain washing machines don't have temperature control. Okay, so what you have to do, 0.5% bleaching powder you have to make. For 30 minutes, you have to immerse the gown in this bleaching powder solution, wash it again with detergent and remove the bleach. Okay, and then dry it and use it. So if temperature control is not available in the washing machine, bleaching powder 0.5% dilution can be used for 30 minutes. Okay. Apron, again, if it is disposable one, discard it. Reusable one, either you disinfect it with 70% of alcohol, detergent water, cap and shoe cover as well. Discard if possible. If reusable, 70 degrees Celsius to 80 degrees Celsius water, hot water. That is enough for cap and shoe covers. Or 0.5% bleaching powder can be done. The same way, how did you wash the gown? The same method can be followed here. Gloves, use disposable ones only. Discard it in appropriate waste bag according to the healthcare facility guidelines. Reusable boots. Boots are usually reusable. Okay, gowns you will never reuse. The gloves that you use will never be reusable. Okay, it has to be discarded. Reusable boots, detergent water or 70% alcohol, that is spirit. Needles and syringe, definitely you cannot reuse it. It has to be discarded. When you discard it, take care that you are throwing it in a puncture-proof container. Okay, and the container should have the biohazard symbol. Okay. Then patient care equipments like stethoscope, blood pressure apparatus, sphygmomanometer, the cleanable part of it, not the entirety of it. Okay, the cuff and all, that you can wash with detergent and water, or you can wipe it with a cotton swab which is dipped in spirit. Okay, or hypochlorite solution. Dry it and then you can use it. And between every patient use, you have to wipe it and then use it. Okay, between every patient use, it has to be done. Then cuffs of blood pressure apparatus, clean with soap and water, followed by appropriate disinfectant. Again, wash it in hot water with detergent if possible. And if it is a non-washable material, then wipe it with spirit or sodium hypochlorite. Okay. And if you have washed it, sun dry it and then use it. And any other instruments like artery forceps, mosquito forceps, okay, tongs and all that that you have used for patient care. Any organic, inorganic matter which is present on that instrument has to be removed either with automated washers or manual cleaning. Decontamination has to be done. Okay, blood, body secretion, if it is stuck to this instrument, that has to be cleaned with soap and water. Then it will be sent to the CSSD for sterilization. Okay. An ambu bag and mask, you have to clean it with detergent, dry and send to sterilizing department or CSSD. You can also wipe the ambu bag and mask with spirit and then send it to sterilization service as well. And for every patient, you have to use a new mask. Mask which was used by a different patient should not be given to new patients. Then standard procedures for cleaning and disinfection. of general equipment that you use for general patient care. Okay, not specific patient care, like thermometer. For various patients, you will use it throughout a day, right? So one single thermometer for all inpatient should be used. After each use, the thermometer has to be disinfected. Okay. Only after disinfection, it has to be used by another patient. Okay. So what will you use for disinfection? Either you take 70% of isopropyl alcohol spirit. Okay. 2% glutaraldehyde will also work here. Okay. So that you can use to wipe the thermometer from the bulb to the body. That should be the cleaning direction. For OPD, each thermometer is kept in separate dry holder. Okay, after every OPD session, when every patient has comes, they have their vitals have been checked, and when they leave, okay, the thermometer holder has to be washed in warm water and detergent, or it can be disinfected with spirit. Okay, for 5 minutes, and then it can be used again for the another OPD patient. So a set of some thermometers are already kept. A thermometer holder will be there, and a set of few thermometers will be kept in OPD. Okay. So together it will be washed, dried, and continued to be used throughout the OPD session. Or you can do is immerse the thermometer in glutaraldehyde solution, 2% glutaraldehyde solution, or hexachlorophene solution, centrimide solution. These solutions can be used at least for 10 minutes if the thermometer is kept in this solution. Wipe it and then use it on the patient. That is also fine. Rectal thermometer, after each patient, it has to be thoroughly washed with detergent. Okay, and rectal thermometer is stored separately from oral thermometer. You should not mix it up. Okay, it has to be disinfected with 70% alcohol for 5 minutes. Then you have oriscope that is used in ENT and all. Okay, after each patient use, oriscope has to be changed. It has to be the earpieces that goes inside the patient's ear. Those are disposable ones. It has to be discarded. Okay. And if you don't have the disposable earpieces, then you have to wash the earpiece with detergent and water, disinfect it for at least 70, or if disinfection is not possible for certain material, okay, 70% alcohol for 5 minutes. If you immerse it and then use it for the new patient, it can be done. But ideally, disposable earpieces should be used. Earpieces, after each patient, wash it in hot water, detergent, disinfect it in CSST, because high level disinfection is used here, because it is something that goes inside the patient's body, right? It goes inside one of the patient's orifices. So it has to be disinfected. Okay. For 70%, with 70% alcohol can be used for 5 minutes. Shaving the patient, razor that you use for patients to shave the patient should not be used again on any other patient. Okay, if you are using one razor on one patient, it has to be discarded. Okay, do not repeat used razors on any other patients. Then bed ends, frames, bedside locker, cardiac table, baby bassinets. Okay, what should you use on these areas, because these parts also touch the patient's body, right? So you can wipe it, wet wipe it with 1% sodium hypochlorite, allow it to dry, and then it can be used by the patients. Bedpans, urinals. So that has to, you have to use heat to infect these. Okay, 82 degrees Celsius at least. Hot water should be used for 2 minutes, and if that is not possible, it should be kept in 7% Lysol solution for 24 hours for an entire day. Or if it is a government hospital and you can't afford to keep bedpans and urinals aside for 24 hours, an entire day, then you need some solution for 30 minutes, right? In half an hour, what you can do. So 3 to 5% sodium hypochlorite solution will also work. Okay. And after immersing it in sodium hypochlorite solution for 30 minutes, they are washed with soap and water and then dried in sunlight, and then the patient can use it. Okay, that is much more feasible. Bowls for washing, cleaned with detergent, water, and store in dry sunlight. Store and dry. Clothes, brushes, equipments, it is supplied from the laundry as and when required. The laundry will take it back again. Okay, laundry department will take care of the disinfection, cleaning, drying. Okay, wherever disposable clothes are available, use that to prevent any cross infection. Curtain rails, same as for bed ends, what we have used here. 1% sodium hypochlorite, the same you can use for curtain rails. Hand basins, just use detergent water where you do the hand washing and all. Lockers, again, detergent water is also fine. Glutaraldehyde solution, 2% glutaraldehyde can be used. Bacillosoid solution can be used. 2% bacillosoid solution can be used for carbolization. Okay. Mattresses and pillows should be kept exposed to sunlight at least once in every 6 months and all. Okay. It should be cleaned regularly. If you can wipe the mattress, wipe it with the same carbolization solutions. 2% bacillocid, 2% glutaraldehyde. Okay, these things you can use to wipe the mattress, pillows and all. Mops that you use for mat mopping should be cleaned daily. Nail brushes are avoided because nail brushes will create certain abrasion on your hands, and it will put the health worker at the risk of developing infection. Okay, you don't want any open wound even at microscopic level if you are going to touch the patient, care for the patient. Okay, even though if you're wearing gloves, it's better to prevent it. So nail brushes can cause some abrasions and all. Toilet bowls and all, commodes, commercial cleaner can be used like Harpic and all, that the housekeeping staff will take care of it. Toilet brushes as well. Walls, whenever there is visible soil or visible dirt, wash it with detergent water. Trolleys, damp clothes with detergent water or carbolization solution can be used. Ampules and vials are discarded. Cardiac monitors in emergency, defibrillators, ECG equipments on a daily basis. Whenever you have done a patient contact on these, okay, the surface has to be cleaned and disinfected. You can use spirit here, okay, 2% glutaraldehyde spirit can be used. Dry it and then use it on the other patient. Different fixtures and fittings. In clinical areas, wipe, damp, dust daily. Furnitures which are kept in clinical areas, you have to damp dust on a daily basis with warm water, detergent, bacillocid solution or glutaraldehyde solution. Same carbolization has to be done. Okay. So that's about